Okay, thank you very much. Welcome, everybody. Good morning. Apologies for my strange camera setup. I had some last-minute technology challenges, but it's great that you can join us all. We're going to be discussing the question that the day is focusing on the summit more broadly, which is knowledge brokering. But we're going to be talking in particular about what it means to be doing knowledge brokering in Africa. And as we know, Africa is a huge continent with a wide range of different contexts. And it's exciting that we've got some really great speakers who know a lot about this, and in many instances actually have it as their very specific area of specialization. I'm going to be pretty quick on my introductions. The order of speakers is going to be Goldman to start, and then Nkululeko, Tshabalala, and Laurenz to follow. After that, we'll have Frejus Thoto from the ACED Center in Benin, and then Ismael Kawooya, after which we'll have our discussant, who's Debazou Yantio. So let me start immediately with Ian, who is the he plays a number of roles actually. He's based in South Africa and works with both the Center for Learning on Evaluation and Results at the University of the Witwatersrand, but also works with the University of Cape Town, and is the co-author of a book that came out, I guess it's nearly a year and a half ago now, hey Ian, on evidence use in policymaking in Africa. Over to you, Ian.
Okay, so good to be with you, everybody. And I want to acknowledge Ismael, who's one of the co-authors in the book, and Laurenz as well, who are also co-authors. So, and this presentation, in a sense, is from myself, Mine Pabari, the other co-author, and Matodzi, and the three of us worked specifically on looking at the knowledge brokering implications that came out from the work that we were doing. And I want to just start off with this analytical framework that was developed in the book by Laurenz, working with Mine and I. And it's to try and understand how evidence gets used. And obviously, as a knowledge broker, we're trying to get evidence used. So I just want to start off with this, introducing this. So the context, of course, within which knowledge brokering is happening, the demand for evidence from policymakers, then some evidence gets generated, and there are interventions which happen, which we call use interventions, which happen around that evidence to try and make sure that the evidence is likely to be used, whether it's making it accessible or building capacity, etc., or building ownership and building relationships. And these trigger what we call change mechanisms. There are these 6 change mechanisms: awareness, agreement, access, etc. And by those change mechanisms, what we hope to achieve is that, particularly, for example, in policymakers, their motivation to use evidence increases, their capability to use evidence increases, and their opportunity to use evidence increases. And if that happens, then hopefully the evidence gets used and there's a development impact. But it's not a linear process, and there's actually constant feedback between each step. And these steps at the beginning are part of what the knowledge broker actually has to manage. So I want to look a little bit more at what is knowledge or evidence brokering. And from the supply side, we need accessible evaluation and research evidence, and it needs to be relevant, and it needs to be credible and timely. But we also need the demand side. So the demand for the evidence, the capability to use the evidence, and supportive and sustainable structures which encourage the use of the evidence. And hopefully there's also demand from the public, from think tanks and parliament. So this is trying to apply, in a sense, that framework, but within the context specifically in knowledge brokering. And the knowledge or evidence brokers have got to be brokering the supply, making sure the supply is available, making sure the demand is available, interpreting the supply so that the policymakers can understand it, etc. And so that's the terrain one's actually working in. But you're doing it within a context where there's all sorts of things going on. So how significant is the policy challenge or question? What are the catalysts of change There might be some crises happening or pressure from development partners or civil society. What's happening in the broader political and socio-cultural environment? Are we close to an election and therefore nobody's wanting to look at evidence at this particular time? Is there space for engagement? And what's the institutional environment in the organizations? And so knowledge brokering involves navigating with environments that are politicized rather than technocratic. There's often divergent value systems. We're working often with hierarchical and bureaucratic systems. There's often fragmentation, lots of uncertainties. Data may or may not be available. There's often a need for urgency and quick decisions. And researchers, on the other hand, are often not very aware of policy realities. And the feedback loops are often weak or non-existent. So the knowledge broker's got to navigate this, and we see three areas of work. They've got to be facilitators and linkage agents, managing the relationships and the process around the evidence, stimulating interaction, trust, and commitment. They need to be knowledge managers and be able to develop, transfer, and translate knowledge to make it easier to access and understand. They need to be developing capacity, both individual and institutional, to produce and use the knowledge. And so these are some of the areas that we think they need. For example, around the facilitator and linkage agent's role, the professional experience, the knowledge of the context, the ability to facilitate processes, the capacity to establish and nurture relationships. And this left-hand column we think is extremely important and often underestimated in job descriptions, for example. So whereas the knowledge management side, which is experience in using particular tools, which might be around stakeholder analysis, situation analysis, the ability to generate or collate evidence, the research skills, that's more known and understood. To some extent, the capacity builders, but the facilitators and linkage agents, we think, is something that's very much underrated. And I've got here, and I'm not going to go through them, but for each of addressing the context, we see certain roles that need to be played by the facilitator and linkage agent, certain roles as a capacity builder, and certain roles as a knowledge manager. Similarly, in promoting demand, during the evidence generation process, and finally, in the follow-up to the evidence generation, to make sure that the evidence is actually used. For example, presentation of findings to management, facilitating ongoing dialogue, or structural mechanisms to make sure reports are discussed and decisions are made, developing briefs and evidence summaries. These are all roles that need to be played. So just in conclusion then, so in terms of strengthening brokering in evidence use in Africa, it's about systems, not just individual capacities. We need to strengthen the anticipation of the need or demand for evidence use through evaluation and research agendas. We need staff with soft skills, facilitation skills, as well as technical skills. We need to develop the capacity to respond quickly to demand. And Ismael, for example, works in a unit that does some great work around this. We need to widen the involvement of stakeholders in evidence processes. We need to find ways to institutionalize the feedback to practitioners and policymakers from users or beneficiaries of policies and programs. And we need to establish knowledge management systems. And we finally, at the end of the day, we need to create more effective learning cultures which encourage the use of evidence and learning from what is and what is not working. Thank you.
That was very time efficient, Ian. I guess having made this presentation several times and building on the experience in the book, you've kind of got it down to a fine art. And I think what's so interesting is the way the model you've described is based on very real experiences. So I'm looking forward to hearing what people think about your contribution. Our next speaker, Nkululeko Tshabalala, is a researcher at the Africa Center for Evidence. He has a master's in development economics and is currently doing a second in competition and economic regulation. He does a lot of work on evidence synthesis, in a range of areas, including land reform, gender equality, industrial policy, and the natural environment. And we're looking forward to what you're going to be telling us, Nkululeko. Laurenz was also a co-thinker on this piece, and I know he's in the audience. So welcome also to you, Laurenz Lange, and over to you, Nkululeko. You're on mute, hey? There you go.
Great. Am I on now? Just got a bit of, okay. I've got a bit of feedback. I'm fine now. Thank you so much. Greetings to everyone present. I think an amazing start from Ian. Really brilliant insights from there. So we appreciate this opportunity, to indulge you in some interesting work that we're busy with. So the effort behind this presentation, I think, goes to many colleagues across the Africa Center for Evidence, as well as the Department of Planning, Monitoring and Evaluation. But for today, I'm Nkululeko Tshabalala, and of course my colleague Laurenz Lange is with us as well, and a lot of others, I hope. So really, for today, I'll be focusing on how evidence maps and rapid response services can help to inform government decisions through use. Of course, I think a good starting point is the point or concept around scarcity, because it speaks to how constrained governments are when they attempt to satisfy the needs of a given population. So, of course, the pandemic as well has further exposed the fact and has created a need for better interventions, interventions that are sustainable, fair, moral, economically sound, as well as politically aware. I would think the final point there is no longer a moot point, but a very significant reality. I mean, not surprisingly, then I think we do look at this kind of the design and implementation aspects of effective strategies. We think should be born from sound evidence as well as a sensitivity to contextual factors. So, of course, with how many or the proliferation of social problems and issues to address in various walks of life, there is a demand to use and institutionalize evidence for more effective responses from government. So for today, really, I think the focus is a case study on a policy relevant evidence map on land reform in South Africa. So I'll just kind of take you through the process of building that within the space of about 3 weeks, if memory serves me correctly. This is a story from 2019, so I hope you find it very interesting. Some history and motivation to kick us off. Of course, this comes as well from the colonial and colonial history and apartheid history of South Africa, and how it has skewed ownership and occupation rates across racial lines. As an interesting fact as well, 9% of the population owns two-thirds of the country's land, which is in particular an impediment to access and security for the rural poor. So of course, democracy has come with quite a few needs for the people to be served, and of course, a lot of this revolves around economic inclusion and fair land ownership. So in September 2018, our current President Cyril Ramaphosa, appointed a panel to really evaluate issues around land reform and provide a policy perspective, with respect to restitution, redistribution, and tenure. And this is where the Department of Planning, Monitoring and Evaluation, the research unit, and the Africa Center for Evidence came together to co-produce an evidence map, which obviously led to responding rapidly to the evidence need. And of course, there at the end, really, when we look at this equation, what we're trying to merge is experts' advice as well as reliable evidence bases. And of course, that would lead to expediting evidence needs across the board. This is just an illustration, a very brief summary of the types of syntheses we have. On the bottom left there, we've got evidence maps, and kind of gives us an idea of how they are able to arrange and organize knowledge essentially in a way that is convenient and accessible. Moving on to the issue of framework development, in this case, it really looked to focus around the policy narrative as well as evidence needs around land reform. So really finding the gist of the problem, finding the gist of the research question. It was jointly constructed between DPME, ACE, as well as the content experts. And what it looked to focus on in particular around the vertical plane there were issues around land reform questions. So that basically guided the development of the framework. So we're talking about issues of restitution, redistribution, tenure, land administration, use management, as well as post-settlement support. Finally, there's a point around the framework development. The needs were aligned with, firstly, the policy recommendations made, and the report structure as well, because oftentimes when you are required to expedite or quicken a process towards evidence use, it helps to be as convenient as possible in how you package information. Next, just a brief overview of the inclusion criteria. 4 countries in the Southern African region of the continent. And of course, the dates that were selected were informed by the respective dates or years of independence for each target country. Looking at intervention, of course, would have been the 6 areas related to land policy that I've mentioned, restitution, redistribution, etc. And we didn't limit our outcomes. Even in terms of study design as well, we focused on empirical, conceptual, as well as theoretical studies. In fact, the only studies that we excluded were papers that exclusively discussed definitions and linguistic issues around land reform. So with this inclusion criteria, I think we tried to be as focused as possible. Just some stats then on the nature and size of the map. I think the most important figure there would be right at the bottom in terms of how many studies were actually included ultimately. And it says a lot about how topical and perhaps even emotive in some sense this issue is. And then just an idea of how the map looked at the end. You will see that on our horizontal plane, we've got the evidence needs, and on the vertical, of course, the aspects related to land reform, which are the 6 areas that I've gone through already. And now, of course, that was part 1, essentially, of the process. Now, in terms of using the map to actually inform the user and the use of evidence, what transpired from there was a writing retreat at an isolated location. The participants, of course, were a mix of people, including the advisory panel, DPME personnel, as well as an ACE member. And it allowed a triangulation process, which made it easy to essentially populate the technical reports for the advisory panel. Of course, this allowed then, of course, as the process of triangulation is, it allowed people to substantiate or refute recommendations and really rely on evidence to come up with the best solutions. So what this exposes as well, or what it gives us an opportunity to reflect on, is the collaboration, communication, as well as access aspect of evidence use. Being that people from different backgrounds could come together and go through this process. The report, of course, this is an idea of the final report. Chair, I've got to check on time, so no worries. And then marrying the map as well as the final report, of course, there were quite a few advantages to having a map and organizing it in this way, because it could also inform how the report itself is compiled. And how the map is used, it's unfortunate that I can't demo this at the moment, but how the map is used essentially is knowing, it makes it easier to know where to access the evidence. It's tailored in such a way that it follows the report structure, which was very important for us. Finally, in terms of reflections and lessons, we've realized the importance of establishing relationships with government departments and personnel. Of course, the term of champions is at the forefront in that regard. Co-production does ensure that you produce an evidence map that's relevant as well as useful. And even going beyond the production of the evidence map, it was also satisfying to see that policymakers were willing to actually engage with synthesis products. And then, of course, it gave us a first-hand experience of evidence into action. Finally, there at the end, on the issue of evidence use, the process transformed from being expert opinion-driven to being evidence-informed, which is, I think those are two very dissimilar things. Examples and hints of instrumental use. This is an important point, and it goes back to how the report was structured or how the map was structured to actually directly inform the report. Thank you so much for the opportunity. Thank you.
Thanks, Nkululeko, and apologies for the time constraints. When you've got such a rich topic to talk about, I know it's very hard to kind of cover the full breadth in 10 minutes, but you did a great job. Thank you very much. Our next speaker is Frejus Thoto, who's an agricultural economist and the executive director of ACED, which is what they describe as a think and do tank based in Benin that works on food and nutrition security issues. In the interest of time, I'm going to keep the introduction short, and I'm looking forward to your contribution. Frejus, please go ahead.
Thank you very much, Dugan. I hope you all can hear me very well. So my name is Frejus Thoto, and as Dugan has mentioned, I'm an agricultural economist and working for a think and do tank here in Benin, which operates like a policy research institute, but with a very large operational department to implement projects on the field. We are a thematic focused organization, so our work is mainly around agriculture and food security. Over the past 10 years, we've been working on how evidence-informed policymaking can be fostered in the food and nutrition security sector. Our main approach is to serve as a broker between the evidence producers and the evidence users, especially the policymakers and the practitioners. We've been doing this for some years through knowledge translation, developing an evidence platform that will gather all the evidence materials that exist, that is relevant for policymakers in the agricultural sector. We do a lot of policy research dialogues, and we are also developing a help desk now that would help policymakers assess and use the available evidence and knowledge to inform the different policies. In 10 minutes, I was thinking about what I can share. Is very short. So I will just stick to some of the key points that would reflect some particular aspects of the context in which we are in Benin and also in Francophone West Africa. And talking about Francophone West Africa, I would like to highlight one specific aspect that is very particular for the region. Is actually related to the concept of evidence. Maybe for the Anglophone community, the word evidence might be straightforward, but in French, it does not have a very clear translation. Some people will refer to données probantes, others would say evidence, The words exist in French, but it's not actually what we are referring to when we say evidence in English. So the first challenge in such a context is that you are in contact with policymakers who are Francophone, and you want to discuss and to engage them with a concept which is not very easy for them to understand. So when you come to adopt the concept of données probantes, which is finally what our organization is using, you now come to the issue of what do policymakers put in that specific context. And a recent study by our organization has shown that most of the policymakers, especially those who are at the local level, because here in Benin we have two types of governments, the central government and decentralized government in municipalities. Those who are at the local level mainly refer to data and statistics. And they don't even talk about research. Evaluation, they are not even aware. But when you move to the central level, you will find senior officials who are very familiar with evaluation, who at some point would just limit the concept of evidence to evaluation. And when you compare the collaboration or interaction with the research community, you see a very clear gap between the evidence producers, who are the researchers at the universities. They are the one making, producing most of the evidence that is available in the agricultural sector, but they are not communicating or interacting a lot with policymakers, for example, from the Ministry of Agriculture. And that's where our role of brokering the knowledge, the existing evidence becomes very critical. And doing this work for some years now, the other lesson that we've learned is that when we say we want to improve evidence use by policymakers, we tend to consider the policymakers as a homogeneous group, which is not at all the case. We've been working closely with officials, with senior authorities, policymakers, and we've come to the conclusion that it can be very challenging to identify who you should work with within the policy arena. Let's take, for example, the Department of, for example, the Ministry of Agriculture. You would maybe think that having the ministry itself very aware of evidence-informed policy making would be something very useful for you. But at some point, you realize that you don't even need to talk to the ministry, and you just have to make sure that those who are technical officers providing support to the ministry, if they are aware of the concept and have the capacities to use evidence, you'll have achieved most of the work that you want to do. And we are also very familiar with discussing with the policymakers over the years. And 2 years ago, we've also come to the realization that we focus too much on policymakers, and we tend not to address the other stakeholders. And two of them have come very as relevant stakeholders in our recent study on the evidence use landscape in Benin. Those are the civil society and the development partners. When you take the policy cycle, for example, the policy formulation here in Benin, you will notice that at some point, civil society organizations and development partners play a very big role in framing that policy, even if their role was supposed to be facilitating. You will see, for example, the FAO providing experts to the Ministry of Agriculture to develop a policy document. And throughout the whole process, that expert or those experts are in a very good position to make that policy document evidence-driven or not. So sometimes we tend to only focus on policymakers, and we forget to work with other stakeholders who officially are not responsible for the quality of the policy document, but they, because of the role that they play, they are in a very good position to make sure that knowledge is used, that evidence is used. So that has make us shift our approach and tend now to continue to work with the policymakers, but develop also very strategic action to include other stakeholders, especially the civil society, development partners, the consultancy firms as well, that are very important in the policy making and even in the policy implementation cycle. The final lesson that I also want to share here with the community is how we approach the evidence use work. Most organizations tend to approach this work by, supporting the production of evidence that we have very quality, high quality evidence that is produced, and they spend less time understanding how or what the policymaker itself wants to achieve. And there, I think it's very important to spend time and resources in understanding what the policymaker itself wants to achieve, what is it doing on a daily basis, so that we can identify routine opportunities for evidence use, and make sure that the work that we are doing is informing something that policymakers are already doing, and we don't create new work for them. So in conclusion, for us to make evidence brokering or knowledge brokering work, there's need to have a contextualized approach and improve our understanding of the general context and the dynamics. Thank you very much.
Frejus. The organization I work with, called the Global Evaluation Initiative, works all over the world, and we make this assumption that we share these concepts like evidence. And in fact, I'm so intrigued by what you're saying that the word doesn't have a direct translation. And I think that's so interesting in relation to what the implications are for the way we support policymakers. And I think what you're saying about working with civil society, development partners, and advisors from the private sector is fascinating. It really talks to the need to be strengthening these ecosystems in a really comprehensive way. So our next speaker, Ismael Kawooya, is a research scientist at the Center for Rapid Evidence Synthesis. He has a strong medical, epidemiological, and biostatistical background. He works with policy and decision makers to support them in accessing and using evidence responsible to their needs. And again, I'm going to keep my introduction short so that the focus can be on Ismael. Ismael, you're very welcome, and over to you.
Thank you very much, Dugan. Good morning, good afternoon, good evening to everyone who is present. And it's an honor to be on this panel. And again, thank you very much. Earlier, Ian made a shout out to to me and the contribution we made to the book that he just presented. So the work that I'm going to talk about in so many ways cuts across the different lessons that previous speakers, Frejus, Ian, and Tshabalala have just mentioned, and it brings across some of the lessons in probably areas where we have oversight in and we don't give too much attention to. So this is work that we've been doing. I think it's just over 4 months, 4 to about 6 months now. It's ongoing, and it brings across quite a number of lessons that I thought would be very interesting to share. Though some of the lessons will actually not be so different from what we've had before. So basically, although I'm talking about a process that is reviewing guidelines for the Ministry of Health, Governance and Management structures and the mechanisms within it. In them, I'm really talking about one of the processes, policy processes that actually happen in the ministry. And this process is basically where the ministry thinks about a solution, or where they start with a solution and say, let us review the guidelines. And when they say, let us review the guidelines, they will go off to a consultant who they expect to go and do primary data collection, research, synthesis, and then come back to tell them that these are the guidelines, this is what we expect you to do. And this has been different for them because they actually requested a knowledge broker, that is the Center for Rapid Evidence Synthesis, to help them. And that's being a knowledge broker, we actually do a number of roles, and some of the roles Ian has mentioned, being facilitating the process, but also ensuring that we coordinate the knowledge management processes of the system. So I'm now going to talk about just that process, and I've already highlighted some of the lessons in there. So basically, the governance and management structures fall within the public administration and governance areas, sectors. And these specific sectors actually hasn't received a lot of attention in relation to evidence-informed policy making. We talk about evidence policy making, and we think about policies in relation to an intervention that is going to be implemented just in the health sector. Let's say a test for COVID and all that, and that is what we're thinking about. And most of the time we forget that this intervention, these processes and decisions actually do happen in context of where these decision makers are actually working, and that is within their administration and governance. So it was very important, and it was very timely for us to take part when we were requested. We were requested to take part at the time when we were trying to look at how do we help the ministry strengthen their capacity to make evidence-informed policy making a routine. And this is something I'm sure many knowledge brokers, many people in this space are actually grappling with. And for us to be given this opportunity, it gave us, it was a promising opportunity to see to that we actually strengthened the capacity of the institution itself, but also the individuals that we were interacting with directly. And also it was an opportunity to embed incentives within the Ministry of Health and the accountability mechanisms in that. And just to give a context of what I'm talking about, when I talk about the governance structures, these are really institutional arrangements for stakeholder engagement and coordination within the Ministry of Health. So the Ministry of Health has several of these arrangements that include technical working groups. I'll show how these arrangements are actually, and they expect the stakeholders who are taking part in this to support the ministry function, specifically in policy making, coordinating and evaluating health programs. However, at the time we were requested to support the ministry to review the guidelines, the ministry was already concerned that the structures had suboptimal functionality. And they had defined this functionality really in terms of do they meet? And when they meet, do they have minutes? And this is really administration and compliancy. And when we came in, we took it at a broader level to think about, when we talk about meeting, what is it that makes people meet, and what is it that makes people participate in these arrangements that you have. I will mention more about that later on. And also, they had noted that the guidelines that we're talking about were in 2013, and they were expected to have been initially updated in 2016 and then in 2020, and none of that had been done. So that having happened, they really wanted that to happen. So these are the structures that I'm talking about. You have departments, and in there they really just the Ministry of Health. But in these structures, there are those that bring on other stakeholders, like the technical working groups that I will highlight here, that have different stakeholders: academia, health development partners, civil service, society, private sector, and all others. And also the Health Policy Advisory Committee that brings on all these other stakeholders. Then the top management, that is really the that should be the highest level of governance within the Ministry of Health, and it brings all the leaders of the health sector, of the different health departments within the Ministry of Health to deliberate and approve specific policies. So, and this is what they actually wanted to review, the guidelines for this that they are looking at reviewing. So our approach to this was really, first of all, we needed to clarify what the objectives were. And thereafter, we took on a number of tasks that included evidence synthesis, primary data collection, where we interviewed a number of people and also had 2 surveys. We also had a policy dialogue to try and understand the context and bring the tacit knowledge of those of the leaders within the Ministry of Health and the stakeholders to the evidence. And then the last process that we're currently going through is the approval process of the Ministry of Health. And this is also very important because you will bring in your evidence after the policy dialogue. And then beyond the policy dialogue, a lot happens to that evidence. And that is a process that we're actually going through, trying to navigate that process and see to that the evidence and the other issues that the ministry has actually fully considered within these guidelines, which is really a policy for the Ministry of Health. So in clarifying the task, the first step for us was to set up a team. And the team, we set up 2 teams that included the core team that had basically the technical teams, mainly from us, ACRES, as the facilitator, and the Ministry of Health, the department that commissioned us. And then an oversight team that included key stakeholders who provided oversight to the different steps and tasks that we were doing. We also conducted a stakeholder mapping, and then in that, as we were clarifying and meeting these people, the Ministry of Health, we had to clarify the objectives. And clarifying the objectives actually gave us quite a lot of context to try to understand what is it that the Ministry of Health wants to do if they're talking about reviewing the guidelines or improving the functionality of the governance and management structures. What is it that they're looking for? And one interesting thing was they actually asked us, can you define for us what governance and management means in context of the institutional arrangements that we have? And that actually set us back, because we thought if you have governance structures that have been around for over 7 to 10 years, or to over 7 to 10 years now, you should be able to appreciate what these terms mean. And then, of course, understanding the functionality and what and the different factors that are affecting that. So in doing that, we had to quickly do an evidence synthesis. And this one, we specifically use the best fit framework analysis. And why we use that is that the framework analysis gives us an opportunity to conduct a policy review and analysis in a short period of time. But also using the best fit framework bit of it is that it gets us to appreciate to look for a framework that really will be adapted to the context. And we use the different, we use evidence synthesis in a structured format to actually get that framework. And the first thing that we did was to define governance and management structures, and that we defined for them. And one of the things that we've highlighted for them, that governance is just a little more than thinking about exercising authority, political, economic, and administrative, but it also involves engagement. It involves partnership and collaboration. And for us to bring the message home, we actually used a collaborative governance framework. And this framework helped us show them that actually when you're talking about governance, when you're talking about how the structures are working, you're really talking about how do you engage your partners? How do you engage these different stakeholders to motivate them and encourage them to be able to participate and come regularly and contribute to the ministry functions as you'd want them to. And management is really allocation of resources and overseeing daily operations. So within these structures, you have some of those structures, some structures like the departments, senior management committees that have these overlapping roles, and that is why they really they talk about governance and management structures. So that is one thing that we had to clarify for them early on, and make sure that with the people that we're working with in the ministry, and as we're presenting to them, make sure that they actually appreciate the differences so that we are able to move forward. Just to show you that in the evidence synthesis, the framework that I was talking about was basically the collaborative arrangement governance frameworks, and this is one that we adopted of collaborative governance regimens that has a number of facets, from looking at the governance and management structures itself to the different mechanisms. You're looking at how do they engage, what capacity do they have, how are they motivated, then the external factors, the leadership, the incentives, the interdependencies and the complexities that are within the Ministry of Health. And we had to show them that all these factors are actually affecting the functionality of the Ministry of Health. So if you want to improve, if we are reviewing the guidelines, we have to pay attention to the different areas and make sure that these different key areas are actually taken care of within the guidelines. So what have we learned in this process? First of all, as ACRES, as a knowledge broker, we've had an increase.
Ishmael,
Sorry?
you're going to need to move a little faster.
Yes.
Sorry, I'm short on time.
I'm aware of time. This is actually my last slide. Okay. So, so we're going to have to. We had an increased appreciation of the context for the policy processes, and in this, we've been participating in several meetings with the Ministry of Health, and these meetings really don't have to do with the actual process that we're going on, but it helps us understand how the ministry, how the policy and decision makers actually think. They're really, most of the time, they're thinking about the solutions before the problems. And when you try to get them to the point, let's first get the problems first, then we think about the solutions later as we go on. That really helps in clarifying the problem and knowing how do you come in as a knowledge broker. Then each of these processes that we've been undertaking is really an opportunity in building relationships, and it's very important to highlight, as everyone has mentioned, the importance of relationships and networks. That this actually requires patience, both in time and place, for you as a knowledge broker, but also knowing that your client, this time the policy and decision maker, is coming from the other side. So you need to slowly bring them to where you are, and understanding that this process involves them doing participating. Then the policy dialogue is definitely something that was very important in helping us adapt and adapt the context that is the evidence to suit the context of the ministry. And also, just as I mentioned earlier, you need to think about what happens to the evidence beyond the time you actually deliver it to the ministry. The process is actually complex. Going through the different structures, discussing and seeing that their values, although they may hear your evidence, they actually have different values, and all those have to be put in context. Then the last point that I want to emphasize, that I want to bring across, is overcoming a subculture. And this subculture, the subculture I'm talking about here is the consultant-client approach. Many of our decision makers, their policy processes are really in form of, let's get a consultant to take care of this process, and the consultant will bring the guidelines, and we'll move on past the guidelines, whatever format it is, that will be done. Rarely, if this process is done like that, it will never be implemented. And if it is never implemented, the guidelines and the different policies end up sitting on the shelf. So for us, looking at that, this policy actually was affecting what happens within the Ministry of Health, and it goes beyond the processes. We're talking about evidence-informed decision-making and the other processes that will happen. It was very important for us to go through this process so that as we're actively working with them, we're actually actively pointing out the different things from the evidence so that these are actually actively being implemented. Thank you very much. That is it. I would want to appreciate those are our partners. Thank you.
That was absolutely fascinating. And I think what really comes up for me is maybe your last point, when thinking and knowledge is outsourced by government agencies, how they can really retain insight. And so fascinating, the institutional perspective that you're bringing. I just want to, anybody on the call, if you can just be sure that you're looking at the chat box, because there's some very interesting comments there, from Ramona, from Ramadan, from Debazou, Sohini asking about accessing the content after the session, Aurélie Lamoya asking, making some very interesting points, Ian responding. Please be sure to check that out. We've got about 20 minutes left, and Debazou Yantio is with the African Development Bank. He's going to be giving us some feedback and reflections. And I'm hoping to still have a few minutes at the end for us to either talk about what's in the chat box or invite people who want to make a point to speak. But I've found the contributions really fascinating. Debazou, over to you. Debazou?
Yes, thank you very much. I hope to be very brief after listening to this very informative presentation. Let me share a slide with you because I've tried to summarize how do I do that? Oh, sorry. Okay. Can you see my slide?
Not yet. Debazou, maybe we can share the slide after the session, but please go ahead and talk us through it.
Okay. What I've listened is the excellent model of understanding the use mechanism that Ian shared with us. So he dissects how we can, or our clients or the policymakers use evidence, and what are the possible mechanisms that we can use or that they use. Nkululeko also spoke about the supply of evidence. And finally, Frejus spoke about the case of the agriculture and food security in Benin. And also Ismael spoke about that same process, but in the Ministry of Health. What I've seen is that knowledge brokering is about the suppliers and the users. So we need to understand, of course, that Ian spoke about the knowledge broker roles. But we need to understand exactly, at this moment, if we want to develop this function of knowledge brokering, we need to understand what are the existing brokering mechanisms, particularly in Africa. And when I look at my experience going through many countries, I see three main mechanisms. We have technical advisors who are appointed to ministers, prime ministers, and presidency. Those technical advisors are those who make sure that all the policies or the proposals that come to those decision makers have uptaken key evidence and what is relevant to make a very effective decision. Also, we have council, the Economic, Social, and Environmental Council, that helps the government formulate policies, proposals. And lastly, we also have NGO platforms that are around the country at different levels, national level, state level, and even local level. So all those three brokering mechanisms, we need to understand what are the factors that make them not effective, because we all see that we are all struggling to make sure that the evidence that exists already are appropriately taken into consideration while we are designing our policies. So the supplies is not a problem, not as much as the use, but also understanding the interface between the supplier and the user of evidence could help us improve the use of evaluation evidence. And I will not come back to what are the context, the motivation, and the capability. Much of the brokering mechanism that I just identified face many constraints in terms of capacity, capability, in terms of motivation, and in terms of context. I think I will stop there. Thank you very much.
That was a very successful synthesis exercise there. So thank you, Debazou. That was really well done. We've got some time left. I'm not particularly skilled on this platform, please forgive me, but I'm wondering if there's anybody in the audience who'd like to make a point, or if there are comments from the speakers who would like to remark on some of the other things that have been said since they presented. Ian, is that you raising a hand?
Yeah, I mean, there was one question directed to me in the Q&A about the capacity building capacities in the continent. So I think I think that, as I mentioned, I think the technical skills around research and analysis is not enough in supply, not enough available, but there's quite a lot there. And for example, the African Center for Evidence did an interesting study of capacity around impact evaluation in Africa. There's quite a lot, but where I think there's a big gap is what I'd call the facilitation skills. And I remember, for the book, when we had some really interesting meetings, and I remember one meeting where Ismael was talking about how he'd moved from a sort of scientist to thinking about the process and how he had to support the process. And I think it's those process skills which are much rarer and that we need to do much more work to build this capacity to support processes and to come from both understanding the supply side and the demand side, but have the facilitation skills to help build relationships, build the dialogue processes that make people trust what's coming and open to the evidence being used.
I think that's something I've always really appreciated from the book, Ian, is the role that the value and importance that you accord facilitation and the kind of the process skill that is actually, as I think we've agreed, in some ways an emotional intelligence that people need to bring. I just want to give each of the speakers a quick opportunity to respond, and in particular, Nkululeko, I'm wondering if you've seen. There were actually two questions directed to you that are asking a similar question, really. How do you ensure that evidence in a gap map is used holistically? And then further on, Tanya Mdlalose was asking, how do you bridge the gap between policymakers and others? And sorry, then there was an anonymous question saying, how do you know that your evidence got used? Do you want to respond to those points? And then Frejus, there's also a question for you in the chat box, which I'll bring your attention to in a moment. Over to you, Nkululeko.
Thank you so much, Dugan. I think I'll try to synthesize all of these in one, so I would hope all the people that asked are listening. I think there was a question on whether or not this motivated government to use evidence more, and I've jotted down a few points here. I think without a doubt, every step in the right direction that garners interest and learning across departments is important. I think working at researcher level, especially, often creates a sense of disillusionment with the process of evidence-informed decision making. But it's quite essential to understand the contribution that such synthesis tools and products can make. On the question about the findings, so the findings were used and recommendations were made, but of course we need to look at this in kind of in the grander scheme of things. I think it's a question I also need to be careful about, in the sense that I can only provide a factual view given our proximity to policy making. There do seem to be delays based on constitutionality and other institutional barriers. I think a lot of you from South Africa would know that it does feel, it has a bit of a put on ice feel to it, but it's one of those things. Of course, there are also some murmurings that it's being used as a political tool, but that's neither here nor there for the purposes of this panel. I think a point was made in an earlier session as well that decision making is inherently political, so some things you really can't escape. As a final point there from my side, I think it was Edward's question. On that issue of using gap maps holistically for decision making. I believe that there are more nuanced approaches, particularly around breaking silos and showing a willingness to engage and educate. Stressing the importance of evidence use being used comprehensively is important. I think especially when applied, and it creates a space for the evidence demand sources as well to be comfortable within the evidence ecosystem. So that synergy is built over time and perhaps steadily. This point also probably goes back to the facilitation point, I think, that was raised. So there is scope for so many skills to be acquired. I think the days of being a one-trick pony in some instances are almost over. We do need to apply ourselves better and hopefully immerse ourselves better in the space or the ecosystem as a whole. Thanks. That's it from me. I hope I've covered everything.
A question actually from Ian to you saying, what does the need to involve the other stakeholders you mentioned mean for the way you do knowledge brokering? And any other like to address?
Yes, I think there is there was a question from Ian on the implication of that need of involving other stakeholders for the knowledge brokering activity that we are doing. I will maybe give a very specific response to that, which may apply to other contexts. In our context, for example, we come to the realization that sometimes we don't even need to talk to the policymakers. Ian, you read, or you were the editor of that book that late Kwakanu wrote, the chapter, and you will see the importance of the producer union and the civil society organizations. So now what we are experimenting is that we are putting our capacities and our knowledge to those organizations whose representatives have already a place at the Ministry of Agriculture. So at some point, we don't even need to try to speak to the official, to the senior officials, or to the Ministry of, to the Minister of Agriculture about which evidence should be used and how policy should be made. If we succeed to make those CSO and producer union informed and aware of the available evidence, we could make the hypothesis that they would transmit the knowledge and include it in the work with the policymakers. One thing that we are doing in practice for that is that we are now developing our help desk so that the producer union and the what is called PASIB, which is the largest civil society organization in Benin, they can request evidence, and for example, if they have a discussion or a meeting with the policymakers, they can ask our help desk to produce a brief for them on the policy issue, and doing that for them would help us to put the knowledge into use by the policymakers without even talking to those policymakers. And related to that, I would like to give a quick comment on one thing that Debazou mentioned about how use the existing opportunities for improving knowledge brokering. And one key opportunity that we don't talk much about is the media. If a parliament person, or if the minister is listening to the radio or to the TV with a journalist who knows nothing about research, about evidence, making assumptions, giving information, and the minister or the technical officers are listening to that guy, you don't know, but you will be writing everything on paper, doing evidence gap maps, briefs, but the guy is just listening to a journalist who knows nothing about what is happening in that development sector. And at the end of the day, he will be influenced by what the journalist is saying. So just to mention that the media also is a very important stakeholder that we should work with. Thank you.
Talks, the more the word stewardship comes to mind, you know, the idea that evidence needs to be stewarded, and it's a very complicated pipeline that it has to travel from production to use. We've got a couple of minutes left, and I'm very keen to hear if Ismael has any last thoughts that he'd like to share with us. And I again want to draw your attention to the interesting chat that's going on both on the chat box, but also in the Q&A box. But Ismael, any thoughts you'd like to share? And then actually, I'm also just going to invite Debazou if he wants to say anything. Over to you, Ismael.
All right. So one thing I can say, and from what is coming out here, is there are different facets to policy making or evidence-informed policy making. So the different poles of what influences policymakers to adopt or take on the decisions that they take on, especially when it comes to the evidence. And this is a process. So when we provide the evidence, we would want to build their capacity. First of all, the evidence has to be there, but you would want to build their capacity. Otherwise, it becomes a one-off process. And if it's a one-off process, then that means when you're out of sight, that is it. They will move on to the next. And this was very important for us, because one of the ways the ministry does is look for an external person, some kind of expert who will manage this process. Whether they've used the evidence or not, the assumption is that this is an expert. So that's the assumption, that they will use the evidence. But when it is provided, they have not interacted with the process. All they do is take it on. We'll probably have 1, 2, 3, 5 points to highlight that this is what the new policy has, and move on to the next, and then the next, and then the next. So we have a situation where you will comfortably say there is evidence. You might comfortably claim there is evidence because a consultant has done it. That is still up to contestation about how it is done. But then again, once it's provided, the people who are meant to drive this process have little or no appreciation for the process. So that is very important, to get them to appreciate your process, and this will go a long way in creating the demand, in having them to come back to you over and over, or someone else. It may not be you. It might even be doing just a simple PubMed search or Google search thereafter, being that they've been more empowered to do that. Or look elsewhere.
We're gonna have to stop there. We're out of time. Fortunately, Debazou has been on fire in the chat box and put some really great content there. Debazou, do you want to just close the session with any last final sentences? Okay. Thank you very much, everybody. I see that the plenary 3 is starting. We need to close the session. Thank you for joining us. Thank you to the speakers. That was really fascinating. And have a good day. Goodbye, everybody. Thanks very much.
Bye. Thank you very much.
Bye.
Bye. Frejus, let's keep in touch.
Yes, we will, Debazou.
Thank you.
Thank you. Yeah. Ian, let's continue by email. Dugan, I will send an email to you.
Interested in your work. It's fascinating and really resonates with what we're doing.
Great, great. I'm also a consultant at part-time with the World Bank, Washington, with your social inclusion, social sustainability and inclusion division.
Okay.
Yeah, I will send you an email just to keep in touch.
Thanks very much.
Thank you very much. Bye.
Okay, bye-bye.